Hello dear students, today we are going to discuss a very high-ill topic of hematology, the morphological classification of anemia. This is one of those topics that is not only useful with exam perspective but also useful in your practice. Now first let's understand what do you mean by morphological classification of anemia. It simply means classifying anemia based on the appearance of RBC, especially their size and the hemoglobin content. This is mainly assessed using mean corpuscular volume, that is MCV, and examining your peripheral blood smear. MCV tells us the normal size of a red blood cell. The normal range of MCV is 80 to 100 femtoliter. Based on these values, anemia is divided into three main types: microcytic hypochromic anemia, normocytic normochromic anemia, and macrocytic anemia. Now let's discuss each in detail, but before proceeding further, please remember on a peripheral blood smear, how will you understand or measure the size of one RBC? So the average size of a normal RBC is 7.5 micrometer. So you compare the size of your RBC with nucleus of small lymphocyte. Nucleus of a small lymphocyte usually corresponds to the size of 7.4, 7.5 micrometer. If your RBC size is similar to your size of nucleus of your small lymphocyte, it is normocytic. If it is smaller than that, it is microcytic, and if it is bigger than that, it is macrocytic. So it is one of the simplest way to analyze the size of your red blood cell. Now let's discuss each of these types in details. First is microcytic hypochromic anemia. In this type, the MCV, which is mean corpuscular volume, is less than 80 femtoliter. So as the name suggests, microcytic means red blood cell which are smaller than the normal, and the hypochromic means the hemoglobin less than the normal, so that they appear paler. So in last video also we discussed about normal morphology of red blood cell and all the other blood cells. So what did we discuss? What is the normal central pallor of RBC? It corresponds to the 1/3 of the diameter of the RBC. So if you are seeing that the pallor is more than 1/3 of the diameter, it is hypochromic in nature, which means the cell is containing the less hemoglobin than normal. In microcytic hypochromic blood picture on peripheral blood smear, you will see smaller red blood cells than the normal, and you will see the hypochromic red blood cells along with the features like pencil cells, teardrop cells, target cells. So this is your microcytic hypochromic anemia, microcytic hypochromic blood picture. Now coming to the causes, the most important cause for microcytic hypochromic anemia in India especially is iron deficiency anemia. Other causes include thalassemia, anemia of chronic disease, sideroblastic anemia, lead poisoning. A very simple way to remember this is whenever you see low MCV, please first think of iron deficiency anemia. Clinically, these patients presents with fatigue, pallor, dyspnea on exertion, and in iron deficiency, you may see the features of koilonychia, alopecia, etc. So a very easy mnemonic to learn the causes of microcytic hypochromic blood picture, that is microcytic hypochromic anemia, is CETL. S is for sideroblastic anemia, I is for iron deficiency anemia, T is for thalassemia, A is for anemia of chronic disease, and L is for lead poisoning. Moving to normocytic normochromic anemia, here your MCV will range between 80 to 100 femtoliter. The red blood cell will look normal in size and normal in color, but their number is reduced. So morphologically, the cells appear normal, but the patient is still anemic. An important concept here is the problem is not with the hemoglobin synthesis, but somewhere else, either loss of blood or less production or increased destruction. One important exam point is whenever you look for normocytic anemia, please look for reti count. If the reticulocyte count is high, it usually suggests the hemolysis, and if it is low, it suggests a bone marrow problem. So the normocytic normochromic is your red blood cell size is also normal, your chromasia, that is the color and central pallor, is also normal, but still there is anemia. Keeping your reticulocyte count in mind, there can be two mnemonics. One is for the causes leading to increase of reticulocyte count in NC blood picture, and the other is the causes leading to the decrease of reticulocyte yet a normocytic normochromic blood picture. So first we will learn about the causes which leads to increased reticulocyte count and the mnemonic for it. Very easy to learn. So shape is the mnemonic for the causes which will lead to increase of reticulocyte count under normocytic normochromic blood picture, normocytic normochromic anemia. What does shape stands for? S is your sickle cell anemia. H is for hereditary spherocytosis. A comes here for autoimmune hemolytic anemia. P is paroxysmal nocturnal hemoglobinuria, and E is for enzyme deficiency like G6PD deficiency. And Ramchandra is the mnemonic for the decreased reticulocyte count under normochromic normocytic anemia. What is the normal reticulocyte count? Between 0.5 to 2.5%. So the normal reticulocyte count is between 0.5 to 2.5%. Coming back to your mnemonic Ramchandra, for low reticulocyte count under NC blood picture, R stands for renal failure, A is for anemia of chronic disease, and M is for myelofibrosis, and Chandra is for the cancers, the metastasis. In all these conditions, your reticulocyte count will be low. One more thing, acute blood loss can also lead to normocytic normochromic anemia. In this condition, your reticulocyte count will be higher than normal. It will be increased, and you can add this acute blood loss to A of your shape. mnemonic. Now let's move to macrocytic anemia. In this type, mean corpuscular volume is more than 100 femtoliter and the size of RBC is hence larger than the normal RBC. On peripheral blood smear, you will see macrocytes, ovalocytes, macrovalocytes, and you might see pencil cells. One very important finding is hypersegmented neutrophil, which is the key clue. In many of the cases, you might find nucleated RBCs also on peripheral blood smear, and the most common cause of macrocytic anemia here is again a nutritional deficiency, which is B12 deficiency. So macrocytic anemia can be of two types. It can be of megaloblastic type or non-megaloblastic. So megaloblastic anemia occurs due to defective DNA synthesis, and the main cause for this megaloblastic anemia is vitamin B12 deficiency and folate deficiency. And second is the non-megaloblastic anemia, which can be because of liver disease, alcoholism, hypothyroidism. In megaloblastic blood picture, you will see sieve-like chromatin, which is not seen in your non-megaloblastic blood picture. Please remember this, which is a very scoring point for your exam. So, as I already mentioned, megaloblastic is because of B12 and folate deficiency. Now we will try to learn the mnemonic for non-megaloblastic causes. So, you must have heard a very reputed college, Lady Harding Medical College, and this is your mnemonic, LHMC. What is your mnemonic? LHMC, where L stands for liver disease. H is your hemolytic anemia and hypothyroidism. What is your M? M is your myelodysplastic syndrome. And finally, the C. What is your C? C is chronic alcoholism. So let's summarize everything, whatever we have learned today, very quickly and very briefly. So on the basis of morphology, on the basis of how the red blood cells look, the anemia is divided into three types. What are these three types? Microcytic hypochromic anemia, normocytic normochromic anemia, and macrocytic anemia. The basis of these division is first mean corpuscular volume. Second is hemoglobin. Normal mean corpuscular volume is 80 to 100 femtoliter. So in microcytic hypochromic anemia, the MCV is less than 80 femtoliter, and in NCNC, which is normocytic normochromic anemia, it is between 80 to 100 femtoliter, and for macrocytic blood picture, it is more than 100 femtoliter. So now you know MCV is the key to classification here. And what are the mnemonics we learned today? For MCSC, we learned the mnemonic CETAL. S is for sideroblastic anemia, I is for iron deficiency anemia, T is for thalassemia, A is for anemia of chronic disease, and L is for lead poisoning. For normocytic normochromic anemia, we learned either the reticulocyte count will be increased or will be decreased than normal. So what is the normal reticulocyte count? It is between 0.5 to 2.5%. And for the causes leading to increased reticulocyte count, your mnemonic is SHAPE, SHAPE, SHAPE. S is for sickle cell anemia, H is for hereditary spherocytosis, A is for autoimmune hemolytic disease, and also for acute blood loss, right? P is for paroxysmal nocturnal hemoglobinuria, and E is for enzyme deficiency, for example, G6PD deficiency. Coming to the causes with decreased reticulocyte count, it is Ramchandra. R is for renal failure, where the problem is with your erythropoietin production. A is for anemia of chronic disease, M is for myelofibrosis, and Chandra is for cancer. C is for cancers, which is metastasis. Coming to the macrocytic anemia, macrocytic blood picture. So macrocytic can either be your megaloblastic type or it can be non-megaloblastic type. In your megaloblastic type, you will have your vitamin B12 or folate deficiency. And for your non-megaloblastic type, the key and the mnemonic is your Lady Harding Medical College, which is LHMC. The mnemonic is LHMC. L is for liver disease, H is for hemolytic anemia and hypothyroidism. What does M stands for? M stands for myelodysplastic syndrome, and C is for chronic alcoholism. That is the summary of whatever we have learned today. One bonus point, which is very important for exam, please note down criteria for hypersegmented neutrophil. Either 5% of neutrophil will be with 5 lobes, or even if you see one neutrophil with more than 6 lobes, it will come under hypersegmented neutrophil. Repeating again, either you will see 5% of the neutrophil with 5 lobes, or if you see even one neutrophil with more than or equal to 6 lobes, it will be characterized under hypersegmented neutrophil. Then you know what is the cause of hypersegmented neutrophil seen during your macrocytic blood picture. Usually it is megaloblastic loss. So that was your morphological classification of anemia, explained in a very simple and structured way. If you found this video helpful, do like, share and save this video for your revision. Thank you for watching this video. See you in next.